Welcome to the newest episode of All Things LOCS, the show where we're discussing everything related to leadership, operations, culture, and strategies for growth. Now, today we're going to be talking about KPIs, everybody's favorite. But in reality, this is an important discussion that we're going to have, guys, because a lot of people out there, whether you're running an organization as an owner, executive, or director, you're getting some kind of data and some kind of metrics for your business. But the real question that we need to start asking is, are they the right data and the right metrics? If you're in healthcare, we understand the importance of having data to make, really informed decisions. But then when we're running a business, we don't always do that. So on today's episode, we're going to be going through really what we define as the 10 most important KPIs every healthcare organization should be really reviewing on a regular, semi-regular basis, and how these KPIs really fit into the tenets of leadership, operations, culture, and strategies for growth, as well as understanding why you should be assessing these numbers and the overall importance, and how these metrics, if you allow them to help you improve your decisions and help you grow your organization, are going to take you to the next level. Let's get this going. I'll see you there. All right. So man. So today we're talking everybody's favorite topic, KPIs. We all love those, but we wanted to obviously dive into this more so for the fact of what people do with numbers, understanding what numbers to actually track, and then knowing, you talk about this a lot. It's like there's the numbers you can track, and then there's the ones that actually help you make progress in your business, which I think is definitely an area that a lot of people get thrown off on. And then there's also the aspect of, should I have 20 KPIs, 30 KPIs, or should I have 2, right? So that's where we're going to dive into what specific ones to really review on a pretty consistent basis if you're running a healthcare practice. But I'm going to maybe kick it over to you, dude, and maybe if you could help somebody understand what is the KPI first for some people who are just probably sitting there saying, I don't even know what that is. And then what's the actual benefit and what's a good number that they should actually be looking at on a fairly regular basis?
Yeah, so KPIs, people throw this kind of this around. So KPI stands for Key Performance Indicator. Depending on the organization, it could also mean like Key Process Indicator, Key Profit Indicator, and Key People Indicator. But for this, we're going to get into it's a performance indicator. And what it essentially is, it's a metric. It is a number that you assign to an activity. And then depending on whatever that activity is, you can determine whether your guys' current performance is up to snuff. It's what you want happening in your business, or it's not. So you're assigning essentially a number to an activity, and that's like a KPI. So you see this kind of in a lot of different places. So especially like in sports, for example, you have a quarterback, they throw the ball 20 times in the game, and they've completed 18. That's a key performance indicator, right? So, and you see this like in sales. Like if someone had 10 sales calls today, they close 5. That's at 50% close ratio. That's also a key performance indicator. So you can apply it to a lot of different places. And the reason why you want to have that is because it's that simple kind of Tony Robbins. Every single guru out there kind of gets this right, where like what gets measured can be improved, right? And so if you can point to it and you can coach it and you can identify when someone is struggling, when you can identify whether a department is struggling, then it gives you some data on what you could do to just improve your business in general. And so that's a KPI, and that's what we're going to be diving into today. What we notice a lot, Dan, is that a lot of people just don't know what to look for. They don't know what to apply. They end up going to ChatGPT, and ChatGPT spits out things, and they're like, okay, what's better than nothing? Why do you think kind of in healthcare, but I think maybe businesses in general, where they're not finding the right KPIs for their specific business and where their business is at?
That's your point. I just don't think they actually know. I think a lot of it is they're looking at very surface level. Right. So it's we had an episode recently, and you were talking about vanity metrics of people tracking revenue.
Yeah.
Right. So it's just how much did we make this week? It's the stuff that I find is very surface level and really actually easy to track. So it's easy for me. So let me just look at that. But then they don't really understand what do we actually need to be tracking that tells us the story of the actual business. And that's where I think a lot of people who are, and this is actually not a knock at all, but just a lot of people who are running businesses, they don't have that fundamental understanding of what the numbers are actually telling me. And that's having a business that they're destroying it. There could still be a lot of stuff that they're missing because they're not understanding, all right, what's actually going to tell me the patterns of the business.
Yeah.
So in healthcare especially, we're looking at I find that there's really two viewpoints there. Number one is that person who owns a practice or an organization who's very all about the patient, so they're tracking a significant amount of patient data, but then they're missing out on some of the business metrics that are really important to help drive the organization. And then there's those organizations that are more business, typically larger institutions, hospitals, that are saying, all right, let's look at the financials. And the patient data is not as important. So it's really coming down to an understanding of, all right, what do we need to get from employee and patient data that's going to tell us how we're doing? But then what kind of data do we need to get from the actual business that's going to tell us how we're doing? And I just feel like a lot of people don't fully understand. And I'll add a layer to that too. And I don't know if how you feel about this, but I think the other aspect of understanding the KPIs is even if they get a good amount of them and maybe 80% of the KPIs that they're tracking are on point, I think the other challenge too for a lot of people is they don't know how often to actually look at it.
Yeah.
Right. I'm going to look at, like I had a guy who wanted to look at the revenue almost like weekly. And it's like, dude, like that's not going to work because the turnaround on getting paid is not weekly. It could be weeks, could be months. So it's not an accurate representation of where we're really at. And all you can do is probably piss yourself off because you look at a bad week and then the next week you have a colossal week. So that's where I think it's at. It's just a fully understanding of, what's going to tell us the patterns of the business. They just don't really know.
Yeah. So a lot of what we're going to be diving into is very healthcare focused. And I think probably the best way to look at maybe KPIs is almost like when someone does blood work. When you do like a full on comprehensive blood panel, you get dozens and dozens and dozens. It depends on how comprehensive it is. Like it's pages of biomarkers, from like testosterone to cholesterol to thyroid, like the list goes on. Like there's a lot there. And so depending on what the report is, then you can kind of determine like, okay, maybe we need to see this person or do another test like every year or every 6 months, just because like they have pristine health. And then you can get another blood report where like, hey, this is indicating cancer and we need to do blood, like a blood analysis, like consistently, because everything is in red. And so even when everything is in red or some things are in red, most doctors, like they kind of isolate down the primary biomarkers.
Like, it's not even, that's not a big deal you're looking at, or it's like, oh my God, 10 things are elevated, and it's like 9 of them are really not an issue at all.
Yeah. So when it comes to this, when we get into some of these KPIs that we're going to be offering you, is that, you want to look at them as like certain biomarkers, like depending on the individual who did the blood panel, maybe you need to keep your eye on like blood pressure, but you don't need to get kind of to your point you're saying a little bit earlier, like you don't need to look at blood pressure like weekly.
Some people might look at it daily, like
some people might do
that. But for somebody like you or me, or if you're healthy, all right, I'm going to assess it once a year.
Yeah, it's like it's like not going to make a difference. But that really depends on what that initial reporting looks like. So when we're diving into a business, that's the biggest things that we look at. We apply the LOCS protocol, leadership, operation, culture, and strategy. We extract what's happening. We run a report, and we're like, these are the areas that are kind of red. These are the areas that are elevated, and these are the areas that are actually really good. So everything we're going to go over today, the KPIs, are the ones that we find to be like tried and true. These are stamped where I want these tracked. There might be some situations with the business where like maybe a handful of them or a couple of them we may not look at, but it really, again, depends on the biomarkers of the business. So the first one, I'll let you kind of take it away, is a big one that you've had a lot of experience with.
Yeah, because I cause a high number of it. And employee turnover rate, I know that all too well. Yeah, so that's a perfect example, right, of you're measuring what's the percentage of employees that are leaving over a given amount of time. So that is a great example of something I would not be measuring daily or weekly, right? Because it's like, all right, but I'm looking at employee turnover rate over the course of maybe 6 to 12 months. It's not just, obviously, as we're talking about, it's not just a matter of measuring it and just saying, all right, we have a turnover rate of 25%. What does that actually mean? Is that good? Is that bad? It's really understanding what is it actually representing, right? So when I lose, an employee leaves, an employee quits, and I'm not talking about those people who have been there potentially for 5 years. It's the ones that are maybe, all right, this is a 4-year position and people leaving in 2, or if it's front desk, which has a high turnover rate, give or take average is about a year. It's like, all right, I have a lot of people leaving in 6 months. It's really understanding, all right, what is this costing us, more so in the sense of how much money and time are we spending on recruiting, then interviewing, onboarding, training people. And those are things that aren't measured from a standpoint of showing up on a profit and loss. So a lot of businesses, they don't really, they look at things very black and white. So if it's not on my Excel spreadsheet or my QuickBooks, then what's the big deal? And what they're not factoring in mostly is the time. So if I have to replace somebody, but then train them with maybe a manager like yourself, now I'm taking the manager's time away. Instead of working on highly important tasks that could drive the business forward, I have them training a new employee because you didn't spend the time to actually keep them. But then I also look at, other things such as I take an employee who's really productive and now replace them with somebody who doesn't know potentially jack shit. Or I got to spend a lot of time training them. So what's the ramp up time? So they're the same. So if it takes, I don't know, like a clinician, like a good example of a physical therapist, take about 6 months to really get them to the level that the prior person was at. So what happened in those 6 months? Less patients, other people seeing those patients to make up the difference. Then you have people who are maybe already burned out or stressed out, at least tired. Now they're picking up the slack. And that's the stuff that's not showing up. And then it's just, what is that doing overall to the morale if you have a high rate? Everybody sees a lot of churn. They're starting to ask questions, and I've been in the scenario where they're asking the question of what is going on behind the scenes that this many people are leaving. Tells them something. So now they think, should I be looking for another job too? Is there something going on that I'm not seeing yet, but I maybe should prepare myself? So that's one I didn't used to track. And then when I started to look at it, and not just because of the fact that I was causing a lot of turnover, but when I saw what the numbers were, it was alarming, man. And then you do the math on, what the replacement cost is for every employee, then that number all of a sudden pops out. So if you have a turnover rate of say 25% and, the average cost is $10,000 or $15,000, you do the math on how many people you're losing per year, all of a sudden you're thinking, damn, I'm losing 50,000, 100,000, large organization, maybe $250,000. So that's one I look at that one because it also tells you a lot about the leadership, tells you a lot about the communication and just overall accountability.
Yeah, and one thing I'd like to throw out there too is that when, let's just say you have two businesses that are like on the other sides of town, like they're relatively close, that they're doing the same thing, same stuff, same size. And one of them has a very, very stable workforce. Like there is no turnover rate,
Yep.
or it's very, very little. It's like almost non-existent. And then the other one has a very, very high turnover rate. And let's just say you're going into the market and someone is like a healthcare leader, someone is a general manager, a doctor, whatever it is. And they look at those two and they can look at Glassdoor, Indeed, and other places. And then they could see like this one has a high turnover rate and this one doesn't. Yeah. What kind of reputation is that going to bleed into your business? So that's one thing to consider, is that it's people who are looking for jobs, especially if your goal with your business is to grow, you're going to need bodies to fulfill. So that's a big one that I'd look at.
I'll throw one little tiny thing before we move on to the next one, which would be if it's the kind of office where patients go semi-consistently, even if it's an orthopedic doctor, maybe they go once a month. If you're going to a physical therapist or chiropractor, you might be going multiple visits per week. They notice that. And I've had patients, I've gone through some challenging times and patients even ask me, what the hell's going on? Or maybe it's a different department within the same organization. Maybe you're conservative clinicians, PTs, chiros, they're great, but maybe some doctors are quitting or the support staff. Patients are wondering, what the hell is going on here that this many people leave? And so, as much as I said, hey, the employees are starting to think, is there something that I'm not seeing? Patients also ask the same questions.
I've had a situation like that in California. I was actually managing a CrossFit facility. I was like in my early 20s, and it was like the largest CrossFit facility like in Southern California. And it was, I remember the athletes or the people that would come in, and it's folks from all over the world would come in because it's like this also like former USA Olympic strength training coach. What was there?
Plus, you were running it, so of course they were showing up.
And the people would tell me like, hey, you're really lasting a long time here. Like you've been here for a couple of months. Like that's rare. And so they would make these remarks to me of like, people don't really work with this person all that well. Like you're here kind of longer. It's been more than a couple of months. Like, they're expecting like this carousel that they've experienced. So yeah, the people will tell you.
100%.
The other KPI that we think is actually phenomenal for you to look at, if you're not looking at it, you should, which is employee engagement. Some people, they look at as the ENPS. I would say it's a leadership KPI. Employee engagement is kind of self-explanatory in a lot of ways. But if you look at a disengaged employee, productivity is garbage. When someone is just half-assing their work, they're just showing up, they're collecting a paycheck, they're kind of moving things along. And you start to pick up like some of the signs, and that could be they stop contributing to ideas. They're maybe not talking as much. They're not helping as, their teammates. They stop caring about the outcomes. Like they don't care anymore. Like you just see a level of apathy start to grow in your organization. And that can lead into turnover depending on how you're paying people, so because people really do want significance. They want recognition. They want, they want to feel like they're contributing to something that matters. And when sometimes those things are not clear, they start kind of pulling away. And then you're wondering like, hey, why is my business like really, really stagnant? Why is it not going further? And it's like, man, my team is just not really, really there. So the business impact on that is when you correct that, when you have your entire workforce, like they're extremely engaged, they love what they do, they show up on time, they're very coachable, you have a better retention rate, it's higher productivity, you get better patient experiences. And even if you're not in healthcare, whether you're working with homeowners or whoever you're working with, like their experience is better just because every single detail matters. There's a stronger culture. So a question for you is, would your employees recommend your clinic as a place to work? So that's a big one, that one.
And I'll add two little things to that. Number one is that Gallup, obviously a large workforce study group, they look at this every single year, and it's been crap really for the last 10 years across the board. It's not just the U.S. and it's not just in healthcare. Average company, it's about 32% of employees are actually fully engaged, and then half of them are just completely disengaged. And the other 15% are checked out. So it's a matter of, all right, what are we actually getting out of these employees? So if you're that organization that, the best of the best are getting about 70% fully engaged employees. So if you're an organization, you can maybe even get it to 50%. What is that extra 20% that you're getting compared to everybody else? What is that actually doing for you, right? It's a huge bump up. And then the other thing too is being able to, this is one thing that I've seen from people is they don't also see the signs of where, somebody quits. And I almost look at it like that relationship. Like the lady's like, dumbass, I've been giving you signs for 6 months that I haven't been happy. Like this is not coming out of the blue. And it's the same thing I find with these employees. Like who is the rock star that's now, they used to come in half an hour early. Now they're coming in 5 minutes early, or, they're not really contributing ideas. They're not taking the initiative like they used to. That to me those are big red flags. And those are opportunities to have conversations. Hey, Antonio, I see you're changing the way you're working a little bit. Let's have a conversation around that versus I just ignored it or didn't see it. And I used to have a trouble with that. I would not see anything. And then the person would quit, and I'd be that, this is out of left field. Like, what do you mean you're quitting? Mm-hmm. And I meanwhile, my CEO was like, bro, don't you see X, Y, and Z? I'm like, nah, I'm not seeing any of that. So there is an awareness. And at that point, I was just, more selfish, focused on myself, not everybody else. But there is an awareness you need to have of what are the employees doing on a day-to-day basis, and are things changing. And it could be a blip, right? Maybe it's a 1 week, your rock star employee is having an off week and you find out somebody's sick or in the hospital. But like paying attention to those signs go a long way to actually helping, improve this. And maybe somebody's checked out and they say, I want to quit. At least it gives you time to potentially find their replacement before you're having to rush it. So that's a big one as well. And then honestly, even from measuring it, I know we've talked about this in the past. Surveys are a little challenging. It's how many people are actually honest when they're filling out that employee survey. But I got away from doing yearly feedback sessions in terms of like reviews, but I would still sit down periodically and get some feedback. So even if you're saying, how do I measure this? Or sit down with them and at least get some feedback from them to ask them, all right, what can we be better at? What are you challenged with? X, Y, and Z.
Yeah. And there's kind of ways you can almost, I'm not trying to say you can trick your staff, but if you incentivize some departments and you kind of dangle something in front of them, and they really start performing. And if there's a tremendous gap between that, we had a client in accounting, and we did like a 90-day challenge with them. And this is something, these were KPIs that they should have been doing anyway. Like it's kind of part of their job. and then we did a 90-day challenge where we had individual incentives, we had team incentives, and then we had like a bonus if all 3 metrics were surpassed. And they delivered. They got it done. And they did within those 90 days, like what they usually do like in a year. And it's just because they were intentional and they were after it. But what it showed us is, for them, they're like, okay, like this was a cool sprint. It starts instilling some habits. But what it demonstrates to us as consultants is like your team can do more by a lot, and it didn't take them anything. It didn't. This is
No.
yeah, like their workflow flow from 90 days ago to now, like it was the same, but they had, what quadruple the amount of numbers, the specific things we wanted them to go after. So that's an indicator to us of maybe their engagement level too as well. So you could do things like that to be like, oh, like this is, you guys should probably be doing here consistently, not this.
Yeah, for sure.
Yeah.
One of the things that a KPI that is very important in healthcare that, and this one always blows me away that a lot of people don't actually measure, is just cancellation and no-show rate.
Yeah.
Right. And that's, I've heard a lot of just, they stop coming in or whatever. We'll just get new patients. We'll get somebody else. Not a big deal. We're still very busy. We still got a lot of patients on our schedule still. And it's just, it really doesn't sit well, because at the end of the day too, it's number one, you're spending money to actually bring the patient into your clinic, right? So there's that marketing cost associated with it. And then number two, just isn't your core focus actually on getting patients better? So if they're not showing up, that's why I'm like, it never made sense to me. So when we think about, all right, how many patients do we have scheduled per week? How many appointments should we have? All right. So what I mean by that too is if you're a PT or a chiro and you may be supposed to have somebody coming in twice a week, and 20% of them are booking once a week. Yeah, they don't show up as cancels and no-shows, but those are still important metrics to track too, because it's all right. That's actually, they're basically factoring in, I'm not going to show up for one, so let me just book one. But when we're looking at the cancellation and no-show rate of a clinic, I mean, really, what is that actually telling you if it's pretty high, right? It's, all right, are we not getting patients better? Or are we not progressing them? Maybe they got better and then the program stayed the same. It's like going to the gym and you say, I'm doing the same exercises that I did on day one, 6 months later. Like, why would you be same and the same weight, right? So it's all right. So I started leg pressing 90 pounds. 6 months later, I'm still leg pressing 90 pounds. Why the hell would I do that? But there's a lot of clinics that do that. They don't progress them at all. So that's a big one. It's just there's no progression. The outcomes aren't there. And then patients stop, coming in. A lot of clinics want to blame the patient, say, well, they're just not fully committed, or, that's just the way it goes. They don't want to pay their copay or some shit like that. I've heard some bullshit excuses like that. And it's, no, you're not actually giving them any reason to continue to come in. And if you see this pattern of, hey, Antonio books 3 times a week all the time and only shows up once or twice every week, and then I don't say anything, I'm basically allowing it to happen. But then we want to wonder, hey, Antonio, how do I make more money? Or, insurance is, a bunch of bullshit. They're giving us more denials and making it harder for us to get treatments approved. But then you have patients that are coming in and you're not actually making as much money simply because of the fact that you can't get them to come in to their frequency.
Yeah. I think especially with cancellation and no-show, you want that consistency on the front end so you can forecast your revenue a lot better. And sometimes I think it can also be like a systems thing. I think more and more you're having companies out there, whether you're getting like a tire rotation, whether you're getting an oil change, whether you're getting your like a teeth cleaning, anything like that. There's a lot of automations there that they send out text, email, follow-up, call, confirmation, because sometimes just people forget.
Yep.
And so you book that appointment, that follow-up, and it's like in 2 weeks from now, and there's no communication until then. It's like, okay, there's opportunities there to integrate some outbound just to get confirmations just to keep it in front of them. And if that bumps up your show rate, it bumps up your revenue. Yes. Just so people are coming in simply because they're not getting that. The cancellation side, it could be a number of different factors, but it's that story that it's telling you is like maybe it's like the bedside manner that these people aren't like, they don't like it, the no-show rate, like why are people forgetting it? So it's telling you a story, it's giving you financial data, but it's also giving you like, what are some things that we need to do in our systems to make sure that we're front of mind and we're continuously delivering that delight. Yeah.
And I will add, everybody has cancellations. It's not a matter of, it should be at 0. That's unrealistic, but it is an understanding, all right, what's fairly average for our kind of setting? And then, do you want to be average or do you want to be better than average? So if, normal cancellation rate is 12% and you guys are sitting at, 20%, well, then you just do the math. It's all right. Number one, we're not even average, but then number two, to, your point, dude, what does that extra 8% represent in lost revenue, lost outcomes, lost ability for maybe referrals? So there's a huge trickle down effect.
Yeah, absolutely. The other KPI is called provider utilization. So one of the questions we would ask is like, are the providers too busy? Are they not busy enough? Are they operating at the right capacity? So provider utilization is a big one. And why it matters is because it helps us determine whether providers are being appropriately scheduled and whether the clinic has sufficient demand, right? So that's really, really important. Low utilization, a couple of things that you're going to experience is like maybe marketing issues, referral issues, scheduling inefficiencies. Low utilization often indicates marketing issues, referral issues, scheduling inefficiencies. When it's highly utilized, it can indicate burnout, capacity limitations, need for additional staff. Here's what the business impact, what it has, is that it's gonna influence your staffing decisions. It's going to influence your growth planning and also your own profitability.
Yeah, this one, the one thing too, dude, is, you said burnout risk or just people aren't seeing as many patients as you'd like. There's also the aspect of, it doesn't really show up quite as much on this one, but even just how their utilization flows with their schedule. So, because then that's the thing too, it's, they're on the high end of utilization. And then you look at the schedule, it's, I've noticed every day there's about 2 or 3 hour gap in the middle of your day where you have barely any patients. So is it that they're really maxed out, or is that you're actually not utilizing their schedule appropriate as well, right? Because that's a big one. I've seen it. It's like, oh, we're really busy between 9 and 12 and then 4 to 6. All right, what happens the other 3-4 hours? Oh, we don't really have anybody coming in. So what do we do with that time? So that is definitely a big one. When we're moving over to looking at, again, one of the big topics obviously in healthcare is always insurance, right? We know how shitty a lot of them are. Unfortunately, they're not really designed to always help patients and definitely not always to help organizations. But then I talk to a lot of owners or maybe even directors, and you ask them, well, what's your denial rate? Or do you know why you're getting I just get a blank look like, I don't know. Like, you don't even know how many claims you're being denied, but then you automatically want to assume, well, insurance sucks. So it's, also understanding too, because again, some people, if you outsource your billing, you need to know that, right? What am I paying somebody? Maybe, some of them on the low end, very 3%, but the average, you're giving another company to do your billing about 6%, anywhere from 6 to 10%. So I'm paying them, and then I don't even know what my denial rate is. And then if it's in-house, how does that represent what your own employees are doing, right? And then what it does is it also shows you, all right, if we have a high rate of denial, the next question is why? Well, what are we doing that's creating a lot of these issues? And again, everybody wants to say, well, Antonio, it's definitely insurance. And then you find out, you know what? We didn't get all of Mrs. Jones's information. Or, Dr. Dan's note was pretty crappy, and that's why I got denied. He wrote barely anything in there and said Mrs. Jones is doing phenomenal. So why would insurance cover that? So when we look at, if you don't understand the denial rate, then you definitely don't understand why you're actually getting denied. And you think that everything's great. So to your point about even the cancellation rate, lost revenue, it's no different. If the average, is about 93% of claims that should get accepted, and about, on average, 7% get denied, and you're at 10 or 12 or maybe 15% denial rate, all right, A, we're losing a lot of money. And then B, some organizations do send a bill to patients because, hey, your treatment didn't get paid. Well, it's your fault if you don't understand why you're even getting denied to begin with. So that's why I look at that one as a huge one, because then it also can vastly affect your cash flow. And then if you have a lot of claims being denied, how much of that is going to be rework that's not even necessary? So we're making all these mistakes, and now the person who's in billing is spending more time on actually resubmitting those new claims to the insurance company as opposed to just identifying what the actual root cause is.
Yeah, and with the denial rate, like if you're at like 12%, 15%, or some whatever the number is, once you identify it, then kind of the goal should be how can I cut that in half, or how can I work towards cutting it in half? And then you're looking at your flow chart of what you're doing from when the patient comes in until those claims are being filed, of like where is the breakage happening, and if you could start plugging those, then your denial rate should be reduced down, which just means that you're collecting more money on the work that you're already doing. So KPI number 6 is patient satisfaction. This is a really big one, because kind of like, when someone goes into a clinic, like did we service this person? Did we help them? Did we just wow them? Would this patient actively recommend us to friends and family in the market? And if the answer is like no, it's like, well, why? So patient satisfaction. Well, under the pillar of the LOCS protocol, we would probably place this under culture, because I think there's the internal culture, but I think there's a culture that impacts how someone feels, like the patient experience. So a patient satisfaction, what it influences is referrals, online reviews, your reputation, and patients who have a great experience often becomes like they become advocates in the market for you. If you went above and beyond, or you're delivering results to anybody doing anything, it's kind of natural for people to spread that, because everybody wants to kind of look good. It's kind of a little bit of a vanity thing. Like whether it's a barber, whether it's someone that's doing like your skincare routine, when you feel great, especially when you weren't feeling all that great, and that's why you had to go to the doctor to begin with, and you're glowing, someone's really reduced down your pain, and they treated you well, and the organization was just a gold standard, you're going to talk about it. It's just human nature. And so the question is like, okay, well, do you want to be running a clinic where, one, you're tracking it, and two, that you're delivering on that? Because you're going to absolutely drown out your competition in the market, because you're putting that at the forefront, is the patient satisfaction. And patients who have poor experiences, they kind of often leave quietly. They might leave bad reviews. They, if someone is thinking about going to you and they hear about it, they'll say, don't go there, go someplace else. And so you just don't want to have that at all on any level. So definitely track that. And there's a few ways that you can do it. And it's definitely through surveys, but also sometimes you teach your staff to kind of ask those questions and have them do them live too as well. So there's surveys, and there's kind of reviews and things that you can do too as well to kind of get that data.
Yeah, I mean, even what is it, a net promoter score, right? It's asking, scale 0 to 10. What would would you refer somebody, right? So if you're getting a bunch of 5s and 6s, and all right, what are we not doing right here? I think that's where a lot of organizations avoid this kind of feedback, because it might not always be good, obviously, right? It's, a lot of patients are telling us we're not really at the level. We thought we were at a 9, and the average is about a 5 or 6. It definitely stings, but then you're also looking at your referral numbers, questioning, why aren't we getting more people? Well, there you go.
Yeah, if you're a doctor, if you're a business leader, and you feel that in your heart of like, I don't want to know it because I want to believe what I believe, is such an egotistical thing, man, and you got to get over that. That's bullshit for you to do that. Live in reality, have the market tell you what it actually feels about you, and then pivot around that, work around that, be grateful for that feedback. Don't put your head in the sand and be like, I believe I'm the best doctor, I believe I have the best business, and completely shun away learning opportunities to sharpen up your company. I like, if you think of some of the biggest, best companies in the world, they would not have got there if it wasn't for feedback. So you want to get that feedback, and it's okay to request it. And honestly, it feels good. I mean, I've recently, like, I was on like Delta, and they asked because our flights were delayed, and I did a survey. I talked about what I liked and what I didn't like, and someone reached back out and thanked me for it, and kind of chatted a little bit. And I was like, that made me feel better just to get that out there, and it's internal versus external.
And then I'll add one layer to that, is actually, if you get feedback that's telling you where you need to improve, do something about improving, right? Because there's definitely nothing worse of, let me get some feedback from you, and then you literally don't do anything about it. Like, what are you even asking me for? And you've seen some people do that. I know my wife, she used to get so furious with Instagram/Facebook, because basically everybody's saying, hey, we want these kind of features. And then they would do the opposite. They're like, all right, well, we're going to actually take away the stuff you like, and then we're going to create new features that nobody even asked for. And then everybody's sitting there saying, we don't even like this. Why don't you listen to us? We're literally telling you that what we'll do to actually use the platform more, and you're not listening. So there is that aspect. It can be very frustrating. So if you're going to get the data, do something with it. When we look at the next KPI, and this is one that I love it, absolutely love it, but documentation and billing error rate, right? So if you're doing notes, and we talked about the denial rate. And part of this is going to be, all right, what is part of that denial? But is it documentation errors, or is it billing errors? And when we assess, really what our good number is, essentially first you have to figure out is, again, what is it actually showing us? Are our team members making a lot of errors? Number one, why are they making errors? Are they rushed? Are we not giving them enough time? Is it overwork? Are they not really paying attention? You know, I've done that. I mean, I write some notes and then I look back and I'm like, what the hell was I doing, dude? This is like shit all over the place. So it definitely tells you what's going on. And then it's a matter of understanding, all right, how do we actually assess it, right? So it's how many claims are we sending out versus how many are correct. And then if we're looking at our documentation, I know somebody's saying, dude, I'm not looking at every single note. And I'm not telling you to look at every single claim per se, but it's just you have to do an audit and take a sample size. So if we take 20 notes a week or 20 claims a week, how many of them are correct? You got to look at just a sample size to give you the overall big picture. And then if we're seeing high numbers, right, then what we're looking at is delayed payments. It's more work, more labor that we're wasting. So we're looking at having also an increased denial risk. And then, like I talked to you, I think I just mentioned about claims don't get paid. And a lot of organizations want to bill the patient. Well, again, are they getting billed for stuff that we screwed up on? So I know when I was in the clinic, anything, and I just kind of established this rules, like anything that we screw up on, we're eating the cost. But a lot of organizations won't do that. They're not going to admit, Antonio, it's our mistake, dude. They just, sorry, insurance didn't pay for it, so you got to pay for it. And then, well, insurance sucks versus, hey, you know what, it's our fuck up. So it's just an understanding too of, what the numbers are telling you. And then part of it too, I think, dude, is, and I'm curious to know what you think, is that it's very easy to also blame the employees if they're making mistakes versus did we actually train them correctly, or using as an opportunity to maybe go back and do some retraining, because maybe at the beginning we left some steps where people just sometimes forget and start making some errors.
Yeah, I think it really kind of boils down to kind of a lack of awareness. So oftentimes I notice that business owners may not want to tackle it head on because it's for a handful of reasons. They're already are at capacity where they're like, I just literally don't have the time to retrain and figure out what's going on. Like it's kind of sink or swim mindset.
Yeah.
And it's unfortunate because you can have a really talented person where they're just thinking like, I'm just lost. Like I'm not 100% sure what I need to be doing here. And so that extra capacity just to create something and untangle it in your head and put it onto paper so they can follow it and then train on it is just not there. So their patience is already rather thin and they just don't have the wherewithal to train this person. And I feel like that really, really sucks because it's a byproduct of your own decisions and how your business is structured that is hurting you in retaining talent that just needs a little bit of guidance and direction. So it's you start moving into this kind of vicious cycle, and I don't think it's really fair to people. But what you need to have too, as well, is you depending on where they're messing up, it could also just be like an encouraging thing. I remember I had sometime back, I had a sales coach or a manager. Like I was doing everything correct, but I think there was like a tone thing that I needed to work on and kind of a mindset thing I needed to work on. And so the steps of what I was doing was down pat, but it was honestly just like the encouragement that they're like, hey, I'm noticing this. I'm seeing a dip here, or there's an opportunity to get better. You can do this, right? Like you're bigger than this. And I was so much in a frame of mind of like, I don't want to mess up that I started messing up. And to get a leader kind of identify that and come in and just be like, you're doing good. Don't sweat it. And honestly, that how tense I was in loosening that up, that actually helped with performance. And so sometimes people might think like, oh, I got to train him and do all this other stuff. When reality is like, maybe it's just going back into how can I pour into this person in a very different way so I could still get that productivity. And maybe it's not this time consuming retraining type thing. Maybe they're just beating themselves up because they just want to do good work. And we need to step in a different way as leaders. Yeah. So
especially when you're looking at it saying, I know you're better than what you're doing, right? That's kind of, that's like a little bit of flag where you're saying like, dude, I know you're better than this. Like, don't overcomplicate it.
I mean, we've had a series of podcast guests that have come through, different doctors and different coaches. And sometimes like they've all said, you have some doctors where they're making mistakes just because they're getting in their own way. They know what to do. They're trained. They're skilled, and maybe they made a mistake or something happened, and now they're going down this spiral.
Yeah.
And the tactical stuff, they know what to do. It's just this needs to be helped, and that's really any person in any role, in any department, in any business. It could be your general manager. It could be your secretary. That everyone needs to be lifted up a little bit. So that's kind of on the other side of the coin, where like maybe it's not just training and SOPs and all that stuff. Like maybe it's just you identifying that a person is kind of beating themselves up and they just need a little bit of encouragement. Yeah.
No doubt.
The other KPI that's interesting, now this is one that we look at that's kind of more long-term, right? This isn't like a weekly thing for us, which is a referral source diversification, right? So a referral source diversification, clinics could get dependent on one physician, employer, attorney, or referral relationship. And you want to keep your eyes on of like when people are coming in, where are they coming in from? And so you can kind of pie chart it, it's pretty easily, and you want to see those fluctuations. So that way, when you do add more people to it, so more patients are coming in, that referral source diversification is a good metric to look at. So you're basically appreciating that your business is operating in a balanced mode versus maybe being hyper dependent on something. Because if that gets pulled out from underneath you, that can completely implode a business or reduce down your revenue significantly, like literally overnight. So those are things that we want to look at. And if it's balanced, it just means that you're going to have more stable growth. It's a lower referral risk. You could have a higher valuation, especially if you're looking at selling and it shows that you have all these different patients coming from all these different places. It actually just looks better. So some can make an argument that it's not exactly a KPI, that it's more of a snapshot of where you are with like maybe a marketing for your suppliers. But we like to look at it consistently, just because what it does is it gives you an opportunity to stay on top of those relationships. Because trust me, there's other doctors and other companies that are also vying for the same relationships, so they can get those referrals going over to their clinic. Hey, come on, give me a shot. Like, we'll take care of them. We'll give you a better kickback, whatever. So you want to be on top of those relationships too, and make sure those are nurtured.
I will say, and maybe I'm in the minority, but I did look at this weekly and monthly, just because again, you're spending really two things. Number one is you're spending the money on marketing. So I also want to know, are the marketing efforts actually paying off? And obviously, if it's a new campaign, that stuff takes time. But then there's also the aspect of friends and family. So we talked about the net promoter score for patients. Are we getting people referring us? Because that definitely tells us, all right, are we actually doing a good job? Number one. And then even if we are doing a good job, are we actually talking to patients about helping other people as well? And then realistically, I'd even look at, depending upon the size of your organization, is even employee referrals, right? Do your own employees? I remember a long time ago, this girl, she was in her 30s. I don't know what I'm thinking. She comes in and just flippantly mentioned that her sister got in a car accident. And I was working in a PT chiro clinic where we treated a lot of patients who got in car accidents, and her sister went somewhere else. And she's like, oh, yeah, my sister went to this clinic, and the boss was like, what are you talking about, dude? Why the hell didn't she come here? And then she just kind of went silent, like, yeah, I don't know why I didn't say anything. Right? So it's more of an understanding, though, of do the employees actually believe in what we're doing? So if you never see any employee referrals, the question needs to be asked, are we actually living up to our mission? Are we really helping people as well as we think we are? So that's like something that I also look at when I'm just looking at where we get our patients from to kind of really hone in on.
Yeah. So if it's a referral source diversification, it's where's the word of mouth coming from? So referrals and word of mouth are, to me, are like synonymous. I do agree with you that if you are doing like a marketing campaign, you're doing like SEO, you're doing whatever, that those are things that we want to look at daily, weekly, like really be on top of your ad spend and what's coming back. As far as a word of mouth referral source, that really kind of depends. I tend to look at those a little bit longer. That's just me. But
yeah, no, I agree, dude. And then when we're looking at reimbursement, obviously, we talk plenty about revenue, but then really understanding, all right, how much are we actually getting paid per visit, right? Because then you could have one clinic seeing, maybe 1,000 visits a week, or two clinics seeing the same amount of visits, and then one clinic maybe getting $95 per visit, and the other clinic's getting $125. It's not the same business, right? And we just did a recent episode on valuation. that's one major aspect, right? Well, we're doing the same numbers. How come this business or practice is valued more? Because they have insurance that's actually paying them more. And oh my God, dude, I remember like when I first started looking at this, because that's how I used to look at it too. It's just, all right, look at our visits and look at our revenue. So we got 200 visits this week. Here's how much we generated. It was a great week. Cool. And then I started dialing it down. And I remember this guy I was working with, his neck was a mess. A lot of pain, burning, numbness down his arm. And so, long sessions. I mean, we were treating for about an hour and a half every session. And then we start getting some reimbursements coming in. And I'm looking at it like, this can't be right. $20 per session for an hour and a half's worth of work. So you look at stuff like that and it's, damn, dude, we gotta do something about that. Doesn't mean necessarily you have to like drop that insurance, but all right, is the approach the same? Now some people say, well, I would definitely drop that insurance. Paying me $20, I'm not gonna take that. I mean, that's less than what some fast food workers make per hour. So when we have an understanding of what are we getting paid per visit, there's also the understanding to come along to that is what insurances are actually reimbursing that as well. So if Blue Cross reimburses $100 per session, and you're say, hey, we're doing really good, and then you find out, what, these United Healthcare plans, they only pay us $30. So what happened if we maybe stop taking United Healthcare, or we start having patients pay out of pocket for it? What would that do to our overall revenue? Jump it up pretty significant. So that's an area where it also tells you what's your payer mix. If you're in network, what are your contracts looking like? And that's the same thing even for workers' comp and some motor vehicle insurance. You could renegotiate contracts if they're that bad. So it just gives you the ability to see, it's not just a matter of busy work and revenue, but are there ways for us to really, I think the good word is optimize our revenue without having to say, if we're getting paid less and less, now we got to start seeing, instead of 1,000 visits per week, we now need to see 1,200 per visit. No, we don't necessarily need to take that route first.
Yeah, absolutely. The last KPI here, I think we might have, so the last one here is cash collected. Really with any business, you want to look at what's actually coming in every single week in terms of cash. This is something you want to be on top of consistently. Cash collection provides a real-time picture of your financial health, right? So you can look at all these other KPIs and everything, but really at the end of the day, it's like what came in, and it's a hard black and white number. And when you're on top of that, because not everybody is, but when you're on top of it, it's going to give you better forecasting. It's going to give you better growth capacity. It's going to really kind of alleviate a lot of stress for you too as well. Because your business has overhead, man. Like it takes money to run it. And so when you have a consistent cash collection coming in and being on top of it, it gives you a little bit of breathing room. And it gives you an idea of what you could save, what you can kind of reallocate to something else that can help you. So that reduction in financial stress is really, really good. So sometimes in looking at your cash collected can cause a lot of stress, but because you're like, oh my God, like I'm in the negative, but you want to look at it. You don't want to shy away from it. So you really, really want to make sure that you are on top of what is actually coming in, what's the hard dollar amount, and just basically doing everything on God's green earth to make that higher, whether it's through efficiencies, whether it's through JVs, whatever. But cash collection is a really big one.
I will say, as I'm listening to you, the first thing that pops in my head is it sounds so stupid for you to be bringing that up, but it's just so many organizations don't actually focus on it. And maybe they're saying, well, I'm a cash clinic, so I collect everything at the front door. It's, all right, do you have maybe any memberships or supplements or services that you offer that people don't always pay on time? And if you're taking insurance, there's definitely the aspect of our accounts receivable is through the roof. It takes us 2 months to get paid instead of 6 weeks. So to your point, it's all right, now how am I adjusting in terms of being able to project? Can I pay the bonuses? Can I buy the new equipment? Mm-hmm. I remember there was one practice that, God love them, but they were terrible at collecting co-pays because they were just so busy. People would just kind of check in, sit down, and then they'd get called back in. And at the end of the week, it's, all right, how many co-pays did you actually not collect? Right? Mm-hmm. So how much cash are you actually missing? It's like, oh, it's only $15, $20. Yeah, times 10. Mm-hmm. Doesn't sound like a lot, but all right, it's $200 times 52 weeks. Like, damn, dude, we just gave away $10,000. Now, it's not necessarily a massive part of cash flow, but like stuff like that that I think people just don't associate. So, it sounds very simplistic, 2 points. Like, you do have overhead and stuff to buy. So if you're not getting cash coming in pretty consistently, how can you comfortably pay for those things? And then two quick ones. We talked a little bit about some aspects of this, but customer acquisition costs. So how much are you spending on marketing? Like, what does it cost you to actually bring a patient through the door? Is it $100, $500? So when you're talking to maybe an internal marketing team, or if you hired somebody, how can you get that number down? What could that do in terms of margins and overall revenue? And then one that honestly never gets discussed in healthcare is just long-term value of a patient. I know some people view that as, ooh, that sounds kind of salesy. But at the end of the day, man, it's like if you have somebody, especially if you're promoting some kind of wellness or preventative care, do you want them to come in long-term and actually stay well, or only come in when they're feeling like crap and sick? So that's one I always looked at as like, and to me, it also indicates, are they actually willing to come back, period, right? So if you're it's very easy for me to justify this one on the orthopedics piece, because we all have our bumps and bruises and chronic pain sometimes that doesn't go away. But similar to patients coming back in net promoter-wise, are they willing to come back in when they're hurting? Or are they willing to come back in for other services? So that's a big one that I would always look at. And realistically, it also helps you adjust or maybe substantiate, all right, maybe the cost to bring in a new patient is maybe a little bit higher than we'd like, but I know what we get per patient financially, so I can justify it.
Yeah. So your client acquisition costs, like if it is a little bit on the higher end, but your lifetime value, there's immense stickability with anybody. It's weird because like sometimes somebone could be watching this and it's like they have a brain surgery clinic and it's like,
yes,
right, but
like cost me $1,000. Well, you made $50,000, so
right. And it's not like that person's going to be constantly coming back every week for brain surgery for sure. So I know, kind of take it with a grain of salt, but you still want to track that because there's follow-ups. There's a lot of other things that kind of come from that. The idea more is to track, like when someone goes into your organization, do they go anywhere else? Do they stay with you? How long is that? And when you're tracking that, it helps you kind of make better judgment calls on like, all right, I'm going to do this marketing plan. My client acquisition cost might be a little bit higher, but my lifetime value is actually really good. So even if I get them and it might cost me a little bit on the front end, I'm going to make up for it great on the back end. Yeah. So I'd rather maybe, so there's this kind of farming mindset of like, all right, let me plant the seed. It's going to take a lot to plant the seed and do all that. And then I'm cultivating it, and then it's harvest. And then it's just going to be feeding over and over again. Like it's going to be, yielding product, or it's going to be yielding a result year over year. Yeah. So it's worth to look at those two things as well.
Yeah, it is. I mean, I think of the chiropractor who brings a patient in, and it's, when do I come back? Oh, whenever you want. Like, bro, what? So for 2 point, brain surgeon, maybe not as relevant. Orthopedic doctor who's maybe doing gel injections in somebody. So that there's definitely some high value there. So as we're, kind of coming to a close, dude, I feel like it's pertinent also just, what do we really, again, like what is the real purpose of having these KPIs that we went over? And obviously we talked at the beginning that there's dozens, but start here. And if somebody's listening, like, all right, these are all phenomenal, just remind me again, why should I be even doing this?
Because you want to understand your business. Not everybody takes like time to do their own blood work just with their own body. Like it's your body, like you're going to have it. So if you have this business and you're responsible for it, you want to find out what these numbers are, because maybe you think you're doing horrible and actually you're doing really, really well. And that's kind of the other side of the coin is like, some people are looking at this where like, I don't really want to do it because I don't want to know how bad I'm doing. But, quite frankly, we've worked with some people too that you do this and they're like, dude, you are so above average. Like you crack the nut on patient acquisition and stickability. Like what are you doing? Like, that's really, really awesome. So you want to do them because it's going to ultimately just tell you a story, and you need to be objective with it. I think the people that tend to want to, shy away from maybe doing this is because they're too emotional. They're kind of in the weeds, and that's not business. I get that, there's a connection, there's a component where you feel like very deeply involved with the business, but that's why people say, business is business. So you want to just look at it objectively, like put a hat on, like do something where you're like, these numbers are only going to give me information that I can improve upon and actually be better and service people, better. So the reason why we also chose these ones is because when we're looking at applying the LOCS protocol, it does touch on leadership, on you, does touch on your operations, like how your system's doing, does touch on culture and strategy. So we have those things specifically because we feel like it's a well-rounded approach just to get a good idea, a good grasp of where the business is. And then there's honestly like hundreds of other KPIs that you can complement, but these are kind of the staple ones that we really feel like every clinic should have.
Yeah. At the end of the day, man, if the KPI is not driving help to make you better decisions, it's either not a good KPI or it's just not a KPI, period. And I think the biggest takeaway I would have from here is that where anybody in healthcare has a very science and data is huge. We love data, but you can get inundated and then it doesn't help. So find the ones that serve, and maybe somebody's listening to this and you're saying, well, there's one or two that I would maybe take out and do something else. Fine, whatever works for you. But just make sure you're picking ones that are actually going to help your organization get better. They're not vanity metrics. They're really, to Antonio's point, designed to really look at the 4 key points of a business: the leadership, the operations, your culture, and your financial strategies.
Maybe qualify that a little bit. I know we throw out like vanity metrics, and when we mean it in a certain way, but what should someone look out for when they're like, maybe I'm just looking at this because I just want to feel good?
No, I mean, to your point about the episode we just dropped, like just revenue, right? Like our top KPI is revenue. All right, but what is that actually telling you? Well, it tells me how good the business is. Meanwhile, it's all right, well, what is your cash flow at the end of the year? I don't track that. Well, what really matters more? Last week you gave an example that business making $10 million, but they're clearing $500,000 at the end of the year versus that organization that's making $2 million and they cleared $1 million. So which business is actually doing better? Well, the one that's obviously making $2 million, but I guarantee you they're probably also the one that's saying, hey, we're drilling down on the metrics that are actually making us better versus the metrics that are making us feel better about ourselves. And that's why I look at when vanity is just, all right, what makes me feel better? And to your point about, all right, maybe you don't get feedback from patients or clients because it doesn't make you feel so good getting feedback that's not the best, like, oh, you guys are amazing. It's ultimately, what is the point that we're trying to accomplish here? It's we're trying to, yes, get outcomes, but we're also trying to make sure the organization grows. We're providing a great experience for the employees. We're providing a great experience for the patients, and you need to have the information that's going to tell you the snapshot of that.
Absolutely.
And if you guys don't know where to start, book a call. We can help you identify these, and if you identify it and you don't know how to build it out, we'll help you with that too. Otherwise, great conversation, dude. This is really awesome. Appreciate it. Guys, we'll catch you next time.
Later.